Good morning, everyone, and welcome to Urban Update. I'm Byron Burnett. On the show this morning, we'll talk extensively about the issues facing women in business. We'll have guests from Boston Business Women's Group, a private online group with more than 2,000 active members who are hosting their first ever conference, bringing together an impressive lineup of speakers, including several women CEOs and keynote speaker Arianna Huffington, president and editor-in-chief of the Huffington Post. The event looks to make history here in Boston. And we'll talk to the founder of Capital W, also having a day-long summit that links up local women entrepreneurs with investors while also bringing to light issues regarding the state of venture capital for women, including the fact that only 2.7% of the venture capital funded companies have a female CEO. That organization's founder will also stop by to tell us how she is putting investors and women-owned businesses in the same room. But up first, healthcare costs are spiraling out of control, and lifestyle behaviors coupled with socioeconomic challenges within our communities are the primary cause. A whopping 75% of our $3 trillion national healthcare costs are related to chronic diseases that are largely preventable through behavior and lifestyle changes. Baraka Community Wellness has taken on this challenge. Headquartered in Boston, this nonprofit's sole purpose is to provide wellness solutions that engage, educate, and empower individuals so that a person's zip code, color, or economic status are not a determinant of health. How do they do it? Well, we're about to find out as our first guest this morning is Executive Director and founder of Baraka Community Wellness, Raheem Baraka. Welcome to Urban Update, Raheem. Thanks for coming in.
Appreciate it. Thank you.
Well, let's begin by sort of going over the eye-opening fact, that statistic, which I find amazing, that many, if not most, chronic diseases are largely preventable through behavior and lifestyle changes. What do you mean by that?
Yeah, it is eye-opening, right? Yeah. The things that we do in our life greatly contribute to the outcomes of our health. So specifically, poor health outcomes are directly related to what we eat, lack of exercise, lack of sleep, engagement, and not doing things that are actually really beneficial for our health.
Okay, now I guess in urban communities, I guess does much of this come back to like information, resources, awareness?
It does. I mean, education, really educating our urban communities about how important it is to take care of yourself in a prevention state before it's too late is very important.
Tell me about, I guess, what Baraka Community Wellness does. How does it play a role in all of this?
No, indeed. Our focus really is on the social determinants of poor health outcomes. So we're talking about lifestyle and behaviors, food access and education, as well as environmental contributors to that. So we provide programs that really touch upon all of those things. Our flagship program, or our signature program, is Healthy Moms, Healthy Kids, which provides programming for mothers and children in the community with fitness, nutrition, mind-body resilience, as well as social support mechanisms.
You talk to me about those 4 points of your integrated areas of focus: fitness, nutrition, as you said, mind, body, and social support. Fitness, I guess that sounds obvious.
Yes, it did.
Just encouraging.
Yeah, I mean, being active in this program is really important. That's really the key of it all. So within the program at Jamaica Plains specifically, we are doing Zumba and strength training that is culturally competent for that area, for our population that's there. And we do that 2 days a week at several different locations throughout the Jamaica Plain area.
What about nutrition?
Nutrition, we provide workshops that are around the educational components of actually how to cook the right things, what to eat during the week, and also provide opportunities for them to cook themselves and meet with our health coaches one-on-one in a health coaching setting.
And what do you mean by mind-body resilience?
Yeah, it's in the now. It really is about doing things mindful eating, mindful thinking, being involved in things that actually are purposeful, in the moment.
And finally, social support. What does social support have to do with your health?
Yeah, well, social support, I mean, there are issues that affect one's health, right? So we involve social workers to have conversations with the mothers that are in our programs as well as the children, and we provide subsidies and support for them through giving away healthy free food, on a regular basis, roughly 1,000 pounds of food per week, to mothers in need.
Now, talk to me about some of your partners in the community.
Several partners. I mean, so our programs on the ground run out of Urban Edge. We run out of Lena Park. We're in the City of Boston, BCYF centers, as well as Brigham and Women's Health Centers, and they're providing incredible spaces for us to run these programs out of.
Now, I'm looking at the statistic I talked about at the beginning of the segment. 75% of our $3 trillion national healthcare costs are related to chronic diseases that are largely preventable through behavior and lifestyle changes. I find that to be just that's a huge number.
Yes, it is a large number.
I guess some people might find that surprising, but obviously you don't.
Well, I mean, it's the data, it's the stats, it's real in what is happening. So, it has to do with individual behaviors and things that impact that. So we focus on the social determinants, which are lifestyle and behavioral things, as well as education components to that.
And what are some of these factors? What are some of the diseases and things that you're seeing that are driving these costs?
Type 2 diabetes, certain types of heart disease, strokes. Hypertension all the way through. And actually, it's interesting because from a prevention standpoint, if you were to walk an hour a day for 5 days a week, you actually lower your health care or your stroke risk by 50%.
Wow, that's amazing.
It is.
Now, I guess what do you try to? I guess how do you get people to change their behavior? How do you do that?
You know, it's daunting, right? And it's complex. You know, so every individual is different. But you know, really getting people empowered to believe in their own health and connect to their own health situation is a very important part. But there's also systemic, overarching issues. You know, there are built environment issues. There's, having safe places to actually be in your community to actually exercise and be outside. There's policy issues. There's food access issues. There's marketing issues in stores that actually keep people from buying the right thing. And there's definitely socioeconomic issues that affect that as well.
And what about, do you have any success stories or positive examples of where you've been able to make some headway?
Yeah, I mean, specifically with Healthy Moms, Healthy Kids, we have some incredible outcomes. I mean, we've seen weight loss with physiological changes, weight loss with our mothers upwards of 65 pounds. We had one child participant who was actually 15 years old who was diverted from hypertension medication, from her doctor because she lost weight in the program. She lost 20 pounds in the program, and it actually helped her reclaim her health, and really excited about that. From a healthcare standpoint and a health cost standpoint, the treatment for that would have been roughly $681 per year. And being the fact that she's 15 years old, lifetime, we're talking about a savings of $65,000 to the system.
Okay. Now, maybe we remind folks where you are and how to get in contact with you. What should people know?
Indeed. Well, Baraka Community BarakaWellness.org, or you can also go to our Facebook page. It's Baraka Wellness at Facebook, and at HealthyMomsHealthyKids.org.
And we have a graphic up there, 1452 Dot Ave. On the 4th floor. Is that where your office is?
That is our office, but we're actually always at the program site. So we're, again, Curtis Hall, Lena Park, Urban Edge, ABCD Head Start, and several other locations.
And what thought would you like to leave everyone, our viewers, with this morning?
Your health is the most important asset you have. So really pay attention to it, and if you need help, go seek it out.
Okay. Raheem, Baraka, thanks for coming in.
Appreciate it.
Again, and good luck with
Thank you.
the great work you're doing. That's amazing. Okay, coming up, we'll chat with the founder of a conference that links women founders and CEOs to investors. That's right here on Urban Update.